I am pleased to welcome New Jersey Democratic Senator Andy Kim to How Will You Fix It? Senator Kim's a member of the Senate Health, Education, Labor, and Pensions Committee and just introduced legislation to guarantee health coverage to every child up to age 26. Senator Kim, welcome.
Yeah, thanks for having me. It's a pleasure.
As I hope this series is highlighting, it appears the country is moving, albeit kind of slowly, towards another major debate over healthcare coverage and cost. What made you decide to step into these very choppy political waters?
Well, well, first of all, I'll say it is because of healthcare that I ran for Congress to start with. So, 8 years ago or so when I first started running, it was because I had a little baby boy who had some real health issues right there as he was born. And I was, one of those very scared, anxious parents trying to figure out what kind of care could my kid get. Meanwhile, we saw a debate in Congress where the Republican-led Congress in 2017 was trying to gut the Affordable Care Act. So that was why I actually got engaged in politics, is my congressman was leading that charge on trying to cut pre-existing condition protections. The other aspect of this is right now things are just moving in the wrong direction. We have upwards of 1.75 to 2 million more kids losing Medicaid over the last year and a half. We see the numbers already atrocious. 4.4 million children in this country without health insurance, 23 million kids without that are underinsured, which means they have coverage that doesn't cover their full needs. I'm appalled by that. I'll be honest with you. We're the richest, most powerful country in the world. I'm here at the Capitol where we're right now having these debates about, a $1.5 trillion defense budget and other things that, just are pushing forward. Yet we are just, for some reason, just just okay with, or at least just allowing this type of void when it comes to our healthcare. And I find the most unacceptable, I mean, all of it's unacceptable no matter what age, but in particular when it comes to kids, I just find it to be, I mean, just appalling. And a real dereliction of our duty that we have not found a way to be able to ensure that every child is able to go see a doctor when they need to without breaking the bank. So I think for me, this has just been years in the making. And right now, I wanted to introduce this because I can't just be talking about what I'm against. I have to be talking about what I'm for. What is the vision for this country? Not just to reverse things that I think are wrong from what this administration has done, but I owe it to my constituents and to the American people to lay out a vision forward for us to try to think through where we go from here.
So, how would this bill work?
Yeah, so I think the first of all, the bill is called MediKids. So as you said, it would be a guarantee of healthcare from birth to 26. I think, one of the more novel parts of this that is different from what we see right now is that there's an automatic enrollment upon birth into MediKids, which is a foundation built upon Medicaid. So the idea right now is, we're seeing so many kids and families losing Medicaid or potentially losing Medicaid in part because of just the onerous paperwork, the bureaucracy, the different types of things that are meant, right now, just the twice annual requirements to be able to recertify. Like that's what's standing in the way here, and preventing so much of the progress that we need. So I wanted to really tackle that, and be able to make sure that people can be able to get the care that they need. And another part of it is that I chose to put the platform upon Medicaid because Medicaid in many ways was designed for kids. With uh, with when it comes to like the early and periodic screenings and diagnostics and treatment, that whole system is, as I've looked at it, really the most comprehensive system for kids. What healthcare experts have really shared with me over the years as I've talked to them is we can't just think of kids as little adults. We can't just be thinking that they can just benefit from being kind of attached to adult focused healthcare programs, which a lot of employer-based healthcare is. You have your healthcare and then you just, you add on, you tack on your kids, right? And no, but instead, like having a system that is designed for kids, that is designed to be able to have the screenings at the appropriate times at age intervals, to be able to have that requirement to be able to treat any and all problems that are determined, and to think about this as comprehensively, not just like healthcare here, dental and vision, but to think about it across all of it. Like all of that is necessary for kids because their bodies are developing, their brains are developing well into their 20s, which is why, again, I pushed MediKids out into the 20s. Is like you want to make sure that all of these kids are able to get the care that they need as their bodies are and their brains are developing, and that you don't see the kind of withdrawal of or restriction of care that could have real consequences down the road. So that's really what we were trying to do.
So, as you well know, Democrats have been fighting for decades now over whether to try, for really comprehensive overhaul of the nation's healthcare system or something more incremental. Obviously, the Affordable Care Act was something more incremental, but also fairly comprehensive. Is that how you envision this? Where do you fall on the let's, pull it up and start over from scratch and the let's try to fix it one step at a time debate?
But yeah, well, look, I want to be bold, and I want something that can really push forward. Because look, I'll be honest, the American people want something bold. Like, the problems that we're facing are enormous. No one is happy with the status quo, so we need to have that change. But I was also thinking through how to design something that I think will have enormous impact upon healthcare, but do it in a way that is implementable. So with MediKids, I'm not creating some new bureaucracy. I'm not creating some new agency or new department. I am taking something that is already, frankly, covering a large percentage of children in this country already, and I'm trying to make it available for everybody through that automatic enrollment and taking something that is proven to be able to have that comprehensive approach and use that as a foundation. If parents want to opt out of MediKids, they are able to. But the idea is that it is there for anybody birth to 26, and they can always return to it if they want. So in that way, I really tried to design this in a way that is implementable. As I've been in Congress now for 8 years, I see the types of bills that can get through parliamentarians and get through into passage. And I really tried to design something that hits that sweet spot while still fundamentally reshaping how healthcare in this country uh, will be attained by people. And I really do think that it will have a sizable impact tremendously, not just in terms of providing that care for kids, but everyone knows like healthier kids means healthier adults, which means a healthier workforce, which means a stronger economy, which means lower healthcare costs. Like the knock-on effects are so strong. So many of the challenges that we see amongst adults when it comes to chronic illnesses and other challenges are often things that have been exacerbated because of the the lateness of diagnosis or the lack of treatment early on. My father was someone who was born with polio during the Korean War and just was not able to get treatment and support early enough, and that caused him to have a severe disability for the rest of his life. That now he has, unfortunately, Alzheimer's now. And so, we're seeing how these problems that he had earlier have really compounded and made things so much harder for him. And it's so much more expensive now. You know,
So,
so, you know, so those are the things that we're really trying to think through when it comes to, this approach.
So all of these plans always sort of, crack up on the shoals of how are you going to pay for it? And I know that in this case, you're not going to ask the states to pay what is now their share of Medicaid. You'd have the federal government pay for it, but Medicaid is sort of, it doesn't pay providers a lot. It tends to be the lowest payer out there, and you would have the federal government pay for it. So how are you going to sort of overcome that hurdle of? I assume this would be pretty expensive, and you would probably have to raise what Medicaid pays in order to get, health providers to buy in.
Yeah. Yeah, we definitely would need to, I mean, like, look, just writ large when it comes to the reimbursement rate for Medicaid. That's something not just for 0 to 26, but more broadly, we need to be looking at in order to have a more sustainable healthcare system, but also be able to get providers on board. So I don't discount that. Right now we're going through some of the calculations and the math. I think we're trying to kind of think through again. There are definitely going to be impacts in the positive. As I said, this is something that I believe is very much going to lower healthcare costs overall as we have a healthier society. We take on challenges earlier in someone's life rather than later. So it's hard right now to and I'm having folks work with me to try to identify where that's going to come down. We certainly know there will be, upfront costs, no doubt. But we also know, look, insuring children is less expensive than insuring adults, especially seniors, right? So, we're starting at a place where it's on the lesser cost side of one's lifetime that will hopefully have compounding benefits going forward that will bring down, a lot of the spikes that we see later on. So look, we're certainly working through that and wanted to make sure that, as we try to push this forward, hopefully in a new Congress where we have maybe gavels in the hands of the Democratic Party that can really kind of run with this. And certainly as we push towards 2028, this is a conversation that I want to be happening across the country. I want candidates in leading up to the midterms, as well as candidates leading up to the presidential race in 28 to be talking about MediKids and talking about a guarantee healthcare for all children as a bold idea forward that not only addresses the healthcare side, but also fundamentally addresses so much of the affordability challenges that I'm hearing from families right now. I mean, the number of people that have showed up to town halls in my state telling me how scared they are of losing their job in this time because the loss of health care for their child. A mother telling me that her kid has autism and is uncertain how she would be able to support, if they aren't able to keep up with Medicaid and other types of services. So, look, that's still something we're building through, but it's something that again I feel very confident that we'll be able to address, especially as we know this is going to have really good long-term impacts in terms of lowering healthcare costs in America.
Back in 1994, when the Bill Clinton plan went down, the first big health reform that I covered, there was an effort, I think, mostly spearheaded by Senator Tom Harkin of Iowa, that they called kids first. That they said, well, let's just cover kids. It still took 3 years, a lot of fighting, and sort of they luckily found a tobacco tax to help pay for it. But it was bipartisan. Do you have any thoughts that Republicans are going to sort of maybe have some renewed interest in increasing healthcare coverage?
Well, what I will say is first of all, if ever there was an issue that should be bipartisan or frankly nonpartisan, it should be about our kids, right? And that's why I wanted to focus on this too. I think it's the strongest argument that we have in our country when it comes to guaranteed health care. I get it, eyes wide open. I was on the Senate floor last year when I saw my colleagues vote to cut Medicaid at such a dangerous level. So I have my eyes wide open. But what I will say is I've gone around the Senate over the last period of time, like last 2 weeks since I've introduced, is that it is sparking that conversation. And whether or not, my colleagues on the other side of the aisle or both sides of the aisle agree with all the different principles and proposals that I have in MediKids, it is creating this dialogue and this debate about healthcare for our kids. And that's what I want. That's what I want us to be able to do. And you're right. Like we've seen bipartisan support in the past for CHIP, for healthcare for kids in different ways. And I just saw that going in the wrong direction last year, which is why I wanted to release this now to try to move it back into the fold. I saw a real deprioritization of concerns raised by parents of kids with disabilities that were worried about how these Medicaid cuts would affect them. It's not good enough for them to just get like a wink and a trust us type of message. We really need to make sure that we just never have parents with that type of anxiety about whether or not they're going to lose care for their child. So, well, we'll see going forward. But at least my early conversations with my colleagues on both sides of the aisle, certainly around the overarching principles of care for kids, is promising. And I'm hopeful to be able to make some gains as we move forward in both the Senate as well as in the House as we start to push forward on that debate there too.
Well, we're all about keeping the conversation going forward. Senator Andy Kim, thank you so much.
Yeah, thanks so much for having me.